Live.
Hi everybody and welcome to tonight's MHTV. Tonight's our second in a series of health and justice focused MHTV sessions. So I'm delighted to have a colleague with me tonight from Health and Justice, Dr Varinder Panesar, who will introduce herself in a minute. I'm just going to go over to Nicky first, who will tell you how to join in the conversation tonight.
We've got another fantastic topic and we'd love to hear from you. So if you're watching on Facebook Live, please just type away in the messages and we'll see that and we can feed those into the discussion. And if you are watching in any other kind of way, please use the hashtag on Twitter, MHTV, and we'll see your message there and incorporate it. So thanks very much. Vanessa?
Thank you. Yeah, thank you. So tonight we're talking about neurodiversity, but specifically neurodiversity in prisons. And we're here with Varinder, who is doing lots of great work at HMP Pentonville. So I'm going to hand over to Varinder first to introduce ourselves, and then we'll get on to the discussion. Varinder, do you want to just introduce yourself and say a few words about your background and what you're here tonight?
Sure. Thanks for having me. So I am a forensic psychologist by training, and I've worked in forensic mental health for the last 12 years since I qualified. And I'm fairly new to prison, so I've specialized mostly in the community, working with children, young people, families who are at risk, and then in some inpatient settings. So prison is still kind of about 2.5, 3 years into being in prisons. And I currently work across HMP Pentonville and HMP Wandsworth. So they're both remand prisons in London. And my role there is to lead up on the therapies provision, particularly psychological therapies.
I always find it interesting when people say they haven't worked in prisons long, because I do think that there is a lot of value in people joining prisons from community settings and bringing experience from outside of prisons as well, because I do think that that's what I did, and I think it does give you a sort of different perspective as well on prisons. Yeah. So I know, so in terms of neurodiversity, I know you're doing lots of great work at the moment at HMP Pentonville, and I'm looking forward to visiting soon. Shall we just start for people who are listening who maybe don't know much about neurodiversity? Just why is neurodiversity in prisons important? Why is this an important focus at the moment?
Okay, so I guess neurodiversity is important in general because we're thinking about the brain that is wired a bit differently to a neurotypical brain. And people who are neurodiverse will have strengths in certain areas, but they'll also have certain challenges which their neurotypical peers won't have. I think you can argue that each of our brains is really unique, so we're all quite diverse. But maybe for the sake of this discussion, we're thinking about neurodiversity as a real kind of lifelong disability that really affects how people might interact or communicate with each other and with the world. So I think in prison, it's really important because even for neurotypical people, prison is a really tough environment. And the struggles that those with, who are neurodiverse might have is going to make prison even more challenging. And, that includes things like how people communicate or their social interaction. So they might not be very good at seeking support, or they might need longer to process information, or they might really not kind of understand social cues, which might get them into more trouble in prison. And prisons are really interesting because although they're quite rigid, I guess, in terms of, or they can be rigid in terms of routines and regimes, they can also be really chaotic and unpredictable and overwhelming. So for people who are neurodiverse, routine and repetitive behaviors can be a really important way of kind of self-soothing. And when you can't control the environment, which is what prison's about, then that can become really overwhelming, really anxiety provoking. Then you might have like an emotional meltdown or a shutdown. And I think it's even it's really important in prisons because you've got this sensory overload that you're also dealing with. And that's for neurotypical people as well. It's very loud, gates banging, keys, shouting. And And for people who might have sensory overload, like they might have sensory needs, so being in a prison can be particularly kind of painful in terms of like an overwhelming feeling to their senses. So I think it's a really complex area. We haven't thought about it enough in the past in terms of prison or the criminal justice system. And we're sort of just expecting neurodiverse prisoners to find a way to cope in an environment that's really tough.
Yeah, absolutely. Yeah, it's really striking. Do you think as well Pentonville's a male prison? Do you think there are any gendered issues around the sort of intersection of gender and neurodiversity in prisons as well?
Yeah, absolutely. I think we're still learning quite a lot about neurodiversity in females, or, and I think the male estate in particular is quite neglected, the male remand estate. So, people come from a background where they might have had really traumatic lives, they might struggle with their mental health, they might have substance use needs as well, and lots of other social, personal, mental health problems. And then if you've also got neurodevelopmental needs, then it's a real struggle in a male prison. I think female prisons maybe get a bit more support or resource, because the way we understand women who offend is a bit different. We think about them maybe a bit more compassionately. We understand they've had trauma, and we think we need to give more support. It doesn't quite translate to the male estate for some reason.
Yeah. Which kind of, it reflects wider society, doesn't it? And men's mental health, and the way men struggle to be able to talk about their mental health or have opportunities to engage in conversations about mental health in the same way as women, because it's doubly challenging, isn't it?
Yeah, absolutely. And I think prison is a place where what I've learned in my experience so far, there's a lot of banter, sarcasm, humor that's used as a way to communicate. And if you're an autistic individual trying to figure out that environment, it can be really difficult because your brain is not wired to understand those things. And it can create lots of problems interacting with other people.
Yeah, absolutely. Do you see it's quite a mixed picture in terms of people who maybe come into prison and don't know that they're neurodiverse, and that's identified while they're in prison, and people who come in with an existing diagnosis? And I guess the support needs of those two groups might be quite different as well.
Yeah, absolutely. I think we are trying to get better at screening. So when somebody comes into prison, they will have an initial, a first day and a second day screen with healthcare assistants and nursing staff. And we really need to do more. And this is some of the stuff that's come out of recent publications, that, we need to do more to quickly identify people that haven't come in with that diagnosis, because they're more likely to either fly under the radar and not seek support proactively and kind of suffer in silence, which in the prison, I suppose, in a place like Pentonville, if you're not showing how distressed you are, you do tend to get neglected, and you might be seen as someone who just sort of keeps to themselves and gets on with things, but actually you're struggling and you're not able to seek out support. Or you might then be on the kind of other end of the spectrum with a lot of like aggressive, violent, or self-harming behavior, which will get a lot of attention, but maybe not the right kind, which means, you end up in the segregation or the block, and there's kind of more punishment.
Yeah.
So it's really important that we're able to know if somebody's coming in with a diagnosis, but also screen everyone that's coming in, so that we're able to pick up and support those who might need further assessment. And, there's higher prevalence of neurodiversity in prison than there is in the general population. So it's really important that we're picking up on it.
So that's interesting. So there's higher prevalence, that would suggest that probably people who are getting caught up in the criminal justice system might be because of some undiagnosed neurodiversity issues, potentially.
Yes. Yeah. And, I think we're getting better. The criminal justice system is, with liaison and diversion services, trying to, see if we can, even before somebody is really, because by the time you come to prison, you've been through a whole process. within the criminal justice system. So the liaison and diversion service is really good at being able to like see if we can kind of divert people into more health services than punish them via the criminal route. But there's still a long way to go.
Yeah, absolutely. But it's good that there's such a focus on it, isn't there, at the moment? And it seems to be an increase in focus, doesn't it, really, across the system? I know I've been reading about, prisons themselves that are starting to employ neurodiversity trained prison officers, and just thinking about that when you were talking then, there's obviously a need for us to have like a more whole prisons approach to this, isn't there, in terms of the prison regime, prison officers, as well as healthcare. So I suppose that leads us nicely on to talking about the developments at Pentonville.
So Pentonville is, it's really exciting what's happening at Pentonville at the moment, because there is no other remand jail that is doing, is putting in the kind of the resource into supporting neurodiverse prisoners. And it took a long time. This is what I've learned about prisons, is change is a very slow process. So to go from idea to action, you have to be really patient, because it's not like community services where you might have more control. We are a healthcare service. We are in the prison's home. So we have to respect that and be patient and persistent. So at Pentonville, about it was the start of 2021, so not long after I joined, we had a group that came together, and that was a governor at Pentonville and myself and a speech and language therapist at Pentonville. And this came out of a conversation that the governor had with a speech and language therapist about somebody that had just been released, who was really struggling to cope on the main residential landings. And there was just a sense of we could have done more for this person. So that led to a board on almost being created, and we met weekly for 18 months trying to plan the opening of a wing that would be dedicated to supporting people with these needs. So it would offer all the things that are recommended in those publications that have come out last year or in the last couple of years around an adapted environment, trained staff, working together, and supporting the staff as well, because it's a really challenging job, and it's everyone's responsibility to look after the men that we serve. And this idea of moving away from silo working, where we just refer to different teams and say, no, it's your responsibility, but actually we take a shared responsibility approach. So it took 18 months of planning, and in August of last year we were able to finally open the wing. And it is about 7 months in of running, and it's going really well. So they've got a dedicated staff group, a prison officer group, who are just so passionate and invested, and they care so much about the individuals they're looking after on that wing. And they really make a difference to these men's lives. So we're hearing, I can read out this quote from a survey that we did. So one of the residents of G1 has said, on the main wing, I felt like I lived in an inhumane kennel. Now I feel part of a family. And really the outcomes that, we're seeing, these early outcomes for the prisoners on there, it's primarily a result of what the staff on there are doing, so what the prison officers are doing, not necessarily healthcare. And there's a lot that's going into it, and it truly is a multidisciplinary team that's working to keep G1 running. But most of the interactions that these individuals have on that landing are with the prison officers, and that's what makes the biggest difference. They feel listened to, they feel safer, they feel like somebody cares. There's time for the officers to follow through on trying to meet the need of someone compared to the other landings. So it's just, we're really excited about that and what's to come.
So the prison officers, have they been recruited specifically to work there? And also, have they had training around neurodiversity? Or was it just more a general interest in neurodiversity that brought them into the prisons?
So both. They had to express interest and then they were kind of screened, and then they had initial training before G1 opened. So that was just to raise their awareness. And since it's opened, they've had kind of regular, almost like lunch and learn slots. It's really hard in the prison to shut down for a day of training. So you have to sort of be creative about how you do that. But yeah, the prison officers are really enjoying being a prison officer, which they weren't doing in their roles on other landings. So they have a real sense of kind of purpose in coming into the work.
Yeah, that's brilliant. It's really positive to hear. Yeah. Nicky, I'm just wondering at this point, do you want to come in with anything from social media?
We've got some questions, if you're up for questions already.
Sure.
Go on then.
Okay, so we've got a couple of issues. So I don't think this is your name, but this is the name that's on Facebook. Rodriguez Abrotisi. Hello, it's a great topic to discuss. Can you discuss some of the misconceptions around neurodiversity, mental health and learning disability and how this is addressed in prison? Melanie Coxon's asked, is this a similar situation in young offenders institutions?
Good questions.
Yeah.
So the first one was
misconceptions.
Yeah, misperceptions.
There are so many misperceptions, I think, and that comes from a lack of understanding and a lack of awareness. So one of the things we found when we trained up the officers initially is they had been mistaking a lot of behavior. For example, for rudeness, somebody can come across as being rude because they take things literally, or they avoid eye contact because they find that overwhelming. And so just in like very small day-to-day interactions, there was just a misunderstanding of why that person is doing it, or they're doing it deliberately. And what was the second part of that question? I think it was...
One was about misconceptions, and the other was, is it the same in young offenders institutions? Same kind of work going on there too.
I think the other misconception that we've noticed more is that often people might struggle in more than one area. So they will have neurodiverse needs, they will have mental health needs, they might have learning needs or a learning disability, and then substance use will come in there, and they might have physical health problems. So I think when you introduce kind of trauma into the picture, it can be really hard to tease out what we're seeing is, you know, what is a result of kind of almost like a trauma survival response, or what is part of the neurodevelopmental need. And so I think it means that people then don't get the support that they might need. So because we might say, oh, this is to do with his autism, but actually it might be to do with the trauma, and so I think we might then miss out on giving people the support they need to address things that they've been through in life. In the young people's prison, so was the question about, does the same support exist in terms of resources? I know at Feltham, because I used to work at HMYOI Feltham, there was a kind of a complex needs unit, which would support any of the young people that were coming into Feltham that might have a complex mix of a variety of needs. And so that was an adapted environment. But I think the young offender institutions were moving towards this kind of trauma-informed way of working a lot sooner than the adult institutions have. So I think in those environments, you'll find that most of the landings that you're on are working in this way of trying to understand the person behind the behavior and trying to make adaptations, and not just think they're acting that way because, they're being difficult.
Yeah, definitely. One of the things that I find as well is that people think about neurodiversity in terms of mental health. So in terms of my role being mental health, if there's anything to do with neurodiversity, it's seen as being under my remit. And also people with neurodiversity being kind of put in the category of learning disability as well. And I think there's a lot of misconceptions around that as well. Would you say that as well, Varinder? Is that your experience?
Yes, and I think I've probably experienced that more in the other prison I work in, where we don't have the same setup. So it tends to be quite kind of silo, and try and quickly identify what is the main need and who needs to deal with this. Whereas I think what we've been able to do at Pentonville is just really have that shared, we all hold bits of information about this individual. Let's try and put it together and look at the whole picture and think about what they need and in what sequence.
Yeah, I agree. And that's very similar to echoes kind of what I say, that really it's about the person in front of you and looking at their needs and where their difficulties are. And then it's just like we would do with anyone, developing a sort of person-centered care plan that reflects what a person's needs are. But I do find, and I don't know if this is your experience at Pentonville, but people get hung up around not having neurodiversity expertise, not being able to work with people who've been screened as having neurodiverse conditions but haven't been diagnosed, rather than just thinking about the person who's been assessed and potentially may have some neurodiversity needs, and sort of working with that individual.
Yeah, I think there's two things there. There's because the person-centered approach that you refer to is one of the recommendations from the NHS England publication about what more we need to do, but just recognizing how hard it is to do in a prison, to have the time to do that, but also I think there's a lot of anxiety about getting it wrong. So some of the things that I've come to be aware of, for example, at Pentonville, is in trying to introduce some of these screening measures in reception, there can be high levels of anxiety amongst nursing staff. That this isn't our area of expertise. But I think when you try and understand it, it's a real fear of getting it wrong and there being catastrophic consequences of getting it wrong. So when you say you're not going to go near it.
Yeah. So have you found that that's changing? Have you found that nurses are feeling more confident in reception to screen people for neurodiversity? I mean, I guess it's quite early days, isn't it? But just curious, because I do agree that echoes some of the conversations I've had about people being quite nervous about using screening tools for neurodiversity.
Yeah, we're working on it. It's it will be a slow change, and I think we are struggling with having enough staff to do the kind of the bare minimum. So I think when you then think about adding something else on, like an extra screening measure and training that might be needed for that, then there isn't currently enough time or resource. But that's something to work on, because these new models of care are coming in through NHS England and London prisons, where there will be focus on someone's early days in custody, so the first 14 or so days, and really thinking about how we work together to understand that person and what they might need, because that's the riskiest time for somebody in prison.
Yeah, absolutely. And then if you bring in neurodiversity needs as well, on top of other, adjustment to being in prison, mental health, as you say, trauma, it is a real sort of mixture of risk factors, isn't it, for an individual?
Yeah, absolutely.
I've got some more questions if you're ready.
Sure.
Yeah.
For someone who prefers to remain anonymous, we appreciate that. Saying that they're working as well in a similar situation, trying to get change in kind of complex system. And what are your top tips for, just because you were saying about how it's really important to be patient? Have you got anything else that person might find helpful?
Yeah, that's a really good question. So I guess, yes, there's the patience and persistence and managing expectations, particularly this idea of we are in someone else's home as a healthcare service. So just respecting that, maybe respecting and accepting that things are going to change quite quickly or might take a long time to change. So there's that paradox. I think it's about finding a champion or finding somebody in the senior management of that prison or that setting who is able to share some of your goals or your vision. So you don't need all of the senior management to be on board. You just need one person who agrees with you, and then that can start to lead to a shift. And I think always seeing it as a kind of a multidisciplinary team responsibility. So the more people you get in the room, the less stuck it will feel. So when you feel like you're the one that's trying to kind of move things forward on your own, it's going to be really hard in a setting like that. So getting more voices in the room, people who might be interested in creating a change. And you can start with a small group. I mean, this started out of a conversation between two people, the governor and the speech and language therapist. I joined that, and there was 3 or 4 of us for a while, and now we're a rich mix. We've got education part of that. multidisciplinary team, and chaplaincy was really key from the start. So maybe another bit of advice is, include people who don't think naturally, or you might not kind of be the first to consider as, but really for G1 at Pentonville, it was the managing chaplain who's worked there for a long time, and she was just so passionate about this that she helped drive the agenda forward, and really think creatively with us about what we could do and how. And I think you just have to keep the momentum going. So even when it feels difficult and it feels stuck, we had 3 opening dates, and the second one had to change because some piping issues came to light. Pipes are 70 years old and they needed to be changed, and that delayed it by another 5 months or so. So we just, at that point, it could have been easy to just say, okay, we're not, we don't think this is going to happen, or it's taking too long, and you sort of give up. But we continue to meet weekly and still think about what we need and how we're going to achieve it. I think those are the main bits that kind of come to me, just being realistic as well about what's possible.
Another person has asked, how did you get involved in this type of work? It sounds really interesting. What led you to this particular field?
So is that forensic psychology or prison, or probably both?
I think they're talking about neurodivergency in prisons.
Okay. Probably through close working with speech and language therapists. So that was my first experience at Feltham, working closely with, it was a very rich multidisciplinary team, but I think the role of the speech and language therapist was really key in kind of creating a pathway and getting people to think about how we screen, how we assess, and being involved in training officers. So that was my first experience, and then it's been the same here at Pentonville. It's working closely with the speech and language therapist. I think their role is so key.
I think from my point of view, I'm actually interested in what you were just saying as well. So why did you end up in prisons? What was that? What led you in that direction? Because people don't always think about psychology in prisons.
Yeah. I think it was, I probably had my own misconceptions about prison, and I think I unhelpfully used to believe that by the time someone's got to prison, there's not a lot you can do to change things, because that's the worst possible outcome. So I was more interested in the community work, and trying to intervene at a point where maybe people could stay, in their local areas. I came into prisons, I think, a little bit by chance. It was a life move. So I moved to a different area, and a job came up in Feltham, in the prison. So that was my first experience in a young offenders prison. And I thought that I knew prisons, and then I decided to go for a job at Pentonville, because I was curious about being able to try and replicate things that we were doing at Feltham in a bigger jail. And I think it wasn't until I came to Pentonville that I realized that, okay, this is prison. This is a real prison, because it's so different to how the young offenders is set up. So it was by chance initially, but I think I've been able to challenge a lot of the misconceptions I had about prison and just the need there and what can be done.
Do not loads more have just come in actually while I've been talking. So one question is, some people say the prison should be a horrible environment because it's a punishment. How easy is it to combat this not kind of negative narrative? And has this been something you've had to get past to develop your own work?
Yeah, that narrative is it's so powerful, and being in prison is punishment enough. And so within that environment, if we're trying to support individuals to return to a society and a community where they can live helpfully and cohesively with other members of society, we have to treat them like human beings. We have to understand what their needs are and support them. I think that narrative, I guess I fear it's going to take a long time to shift that narrative. I think we get it when we work in prisons, and those, whether we're operational staff or clinical staff, we are in that environment, so we understand what needs to be done. I don't think it's it hasn't translated or generalized as much to society. And I think that, the media's reports of prison and prisoners and what we should do to punish people more kind of feeds that narrative. I guess we've been lucky in that we've had really strong, we've had alignment from key people who can create change in prisons. But yes, there will be senior staff and management and on the governor level who just believe that, this is just, it's too late for this kind of stuff, or they don't deserve it. And that it's just about somebody making a different decision. And it's a very simplistic or a narrow view. I think we're always going to come across those individuals who work in these settings. And you've got to try and see how you bring people alongside, because you can't drag them along with your point of view. You have to kind of understand where they're coming from, what's driving their anxiety about change, and then think about who else you can bring into the room that might be able to challenge that view. I think really interestingly, at Feltham, when I worked there, we had for a long time, we were having these repetitive meetings with some of the governors who were not aligned at that time with the need to kind of train up officers and work in a more trauma-informed way. And it just took one governor who said, right, I'm tired of having these conversations of talking about doing things, let's just do it. And then the others shifted in their views. So they, you just need that one voice. So I think you always have, it will always be an uphill climb when we think about prisons, because it feels okay to say punish more. I think we try and be a bit compassionate to where that view is coming from and how we might be able to go alongside it, but also find a common ground.
And also pragmatically, prison is expensive.
Yeah,
it needs to work so that people don't do it again. Otherwise it's money wasted.
Yeah, absolutely.
Warehousing instead of rehab, isn't it?
Yeah, and sometimes the language we use is different, but we're talking about the same thing. So you might have a governor that wants, less violence, and we do want less violence, but we're maybe from healthcare, we're talking about, we want safer relationships, and we want to improve relationships between officers and prisoners, and so that will lead to less violence. So we're talking about the same goal in the end, we're just describing it in different ways. So I think sometimes it's looking for how the language might just be masking actually a mutual goal.
I've got a couple more, and then I'll stop. So one is, was specific funding secured for this work? Just wondering about the arrangements and investment needed because of resource limitations, which I think 1,000 people hearing this will be like, yes.
Yeah.
Where'd you get the money from?
Yeah, I mean, gosh, that's been a challenge, because we've had no extra money to open this wing. It's had to come from existing resources. So we've had to be creative about how we do this. We've always been clear that this is a prison wing. The governance lies with the prison. It's not a healthcare wing, but it will benefit from heavy healthcare input. And there's weekly multidisciplinary meetings that happen on there, and reflective practice for the officers that work on there. There's a sensory room that's about to be installed. So we were able to get funding for that sensory room through our NHS. But aside from that, everything has come from our existing resource. That was really difficult because it's already, under-resourced. And so we're thinking about adding something new, but without no more resource. And I think that's led to some frustrations for the prison staff. This kind of expectation that healthcare would do more and would be more visible and would have much more input. And what we're trying to work on is helping them see the value of their roles, that actually they're the ones making a difference. They have all those hours more a week with the men residing on that landing. We might see someone for an hour a week, but really it's their influence through their interactions that is the most powerful. So I think that's still something we're working on. But we came to this following a recognition that if we wait to get more resource to do something different, actually we'll be waiting a long time. No one's coming to save us, so we've got to save ourselves in some ways and think about how we can work together and be creative.
Yeah, the last one I've got is, can you speak about the difference between neurodiversity versus neurodivergence? So not all people will attract a neurodiversity diagnosis or will have neurodivergent needs. What can be done to ensure we don't pathologize people who are not neurotypical? So for anyone that maybe doesn't meet the criteria for a special wing.
Yeah, that's really important. I think it's really important, but it's also really hard to do in a prison environment. You know, how do you treat each person as a unique individual, understanding their unique strengths and needs, and put in place what they need at the right time? So just that process requires somebody to have the time and thinking space and the resource. And it's just not there yet in prison. So I think sometimes, unfortunately, there are shortcuts that have to be taken, which mean people, get pathologized or fly under the radar. Or we end up doubling up on interventions when actually that's not what was needed. I don't have the answer to kind of how we do that, because it's such a systemic issue, but I think it's important. And maybe the better we get at screening when someone arrives, the easier it will be to see what exactly they need.
Yeah, I was thinking that. Yeah, I was thinking just that really, that if you've got a prison which has got a high profile neurodiversity wing, you would hope that the ripple effects of that would permeate across the whole prison, wouldn't you, with the other officers and with healthcare. And as you say, that it's about the whole prison being skilled up from assessment onwards, you know, and work, as we said earlier, it's about working with an individual, isn't it, in a person-centered way, and understanding their challenges and how you work with that person, I would think. But it's
and
really...
just because somebody doesn't reside on that wing doesn't mean they shouldn't benefit from added support through outreach or other means.
Exactly.
I think that's something we need to work on at Pentonville.
One of the things that I want to ask you about was you've mentioned about speech and language therapists, and I think quite interesting just to focus on that for a minute, because I think people have got a perception of speech and language therapists from sort of what they did in the past, and obviously in terms of neurodiversity, they're quite a critical group of staff now, aren't they? So do you want to say maybe just a little bit about how they're working within neurodiversity in Pentonville?
Yes, so speech and language therapy really is, it's really important in prisons, because I think if you look at the research, about 60% of those coming into prison will have speech, language or communication needs. And compared to the general population, which is more around kind of the 4 or 5%, you know, this is significant part of the population is going to need some support in how they communicate and navigate their environment. So sorry, Vanessa, I forgot the second part of your question.
No, I guess I was just, you know, I keep hearing about, you know, speech and language therapists and how they're starting to be used in much more innovative ways. And I think a lot of people, I'm not saying people are dismissive, but I think a lot of people don't understand the value that speech and language therapists can add. And I know that you're working with them, you know, in Pentonville. So I was just thinking for people listening, just to kind of raise awareness really of the role and what they can contribute to the multidisciplinary team. Yeah,
absolutely. So, you know, really helping with assessing and formulating someone's needs. That speech and language therapy, a therapist at Pentonville does so much of that systemic work and upskilling the officers. So really understanding what each individual needs in terms of communicating effectively and making sure that's written down, and people have communication passports and those are widely shared amongst all the staff. Really advocating for the needs of these individuals, whether it's in kind of liaising with community teams or you know, reading and rewriting parole conditions or probation conditions. So when people are approaching release, often they get, you know, license conditions, which can be really lengthy and complicated and hard to understand. Somebody breaches a license condition, they're back in prison. And of course, if it's not given to them in a way that's accessible for their needs, how can we expect somebody to follow their conditions? So I think the speech and therapist's role is really key in just helping somebody, not just in prison, but also transition into the community and get the support they need. I think there's also a strong link with kind of physical health, because I think where you've got for instance, if you've got an autistic prisoner who's also got learning disabilities and mental health issues, there are likely to be significant physical health needs that go undetected and, you know, or not addressed effectively. And I think what the speech and language therapist is really good at just looking at the whole picture and thinking about that individual's needs from a kind of a zoomed out perspective, advocating for them, referring, and just upskilling the workforce as well. But that's only part of their role, because they also do a lot of one-to-one therapeutic work, whether it's helping somebody learn social skills or communication skills, or think about those with developmental language disorder, and you know, thinking on a one-to-one or group setting of what skills somebody needs to learn and how they can get them through therapy.
It's fascinating, isn't it? Yeah, that's great. Thank you. I mean, I think they are an underutilized resource, so aren't they? I think throughout our health and care system. So it's really interesting to hear about the profile of them within prisons now, and how they're adding that holistic benefit as well, and working with teams. So yeah, it's interesting. I mean, we're coming towards the end now, but I also wanted to ask you a little bit about working in a trauma-informed context, because I know we touched on it both in terms of, you know, working with people in prison, but also the staff group. And I know when we had our panel last week discussion, it was also mentioned there. So I guess from your perspective, how does this work interface with trauma, and what kind of developments are happening around making the prison more trauma-informed?
Yeah, we're trying to take the learning, like that ripple effect that you'd kind of described earlier, of if staff come and work on G1, they might pick up on some practices and ways of doing things. But we're also thinking about how we might mirror what's happening on G1 on other landings, where you've got 200 prisoners instead of 45, and you've got much fewer staff. So people are already overstretched and stressed. So that will be kind of the longer game, and that's how I see trauma-informed care in prisons. It's a really long vision. You know, this is a cultural shift. It's a different way of thinking and working, and we won't change it quickly. I think we've been able to start on G1, and now it's about how we kind of widen out slowly.
Yeah, that's great. Thank you. Nicky, just aware we're coming to the end. Any more questions?
Yeah, I was just looking at the instructions I'm getting from Dave. So one is to say, just finishing up the last questions, love this discussion and the focus on supporting and empowering prison officers. Best way to change prison culture and increase skill capacity. Prison officers often have an insightful knowledge about prisoners, but lack the tools to fully explain and make sense on how to respond best to their needs. This work is really impressive, and I'll be reaching out for more information. That's from Tanya. And then speech and language therapy has been pointed out as well, that health literacy in prison, then people have an average age of 9 to 10 years, so it's massively important to support people's communication. And just to remind people that next week we've got Paul Smith, Claire Henderson and Elaine Armstrong talking about advanced practice. So that's what I wanted to say. But thank you very much. I feel like I've learned loads, Varinder. Thank you very much. Much appreciated.
Thank you for having me.
Yeah, Varinder, I guess over to you if you've got any take-home messages that you want to put across, or anything we've missed tonight that you think is important to cover before we finish up.
Probably two things. One is, if you'd like to come and visit G1 and see how it's functioning, just send an email. We're having visitor days throughout the year, so we'd love to host you. And the other thing is probably just a bit of a recruitment plug in terms of working in prisons. If you're a mental health nurse or a psychologist or a speech, you know, from whatever discipline, or if you're interested in coming into work in prisons and want to learn a bit more, you know, we'd love to have those conversations. So get in touch. Definitely.
Thank you. And I'll just end by saying that Varinder is speaking at our Health and Justice event next week. So next Monday, we've got a National Health and Justice event, which is on intersectionality. So we'll be talking about neurodiversity. We'll be talking about gender in health and justice. We'll be talking about cultural diversity and various other topics. There'll be a full day conference, which you can follow on MH Injustice on the hashtag. And we're hoping we'll have some more MHTV interviews as well after after the event as well. So yeah, just a plug for that as well before we finish. But thank you. It's been really interesting having you on tonight. And yeah, look forward to coming and visiting Pentonville as well myself.
Yeah,
So yeah, thank
Thanks.
you.
Good night. all.
We'll see you all next night. Bye.